Hi everybody, my name's Vicky Gilbert and I work as a volunteer at the Sir Robert Ogden Macmillan Centre at St James University Hospital in Leeds. I've been treated for cancer twice myself, and the reason I started working with other people that are living with and beyond cancer is because they found the opportunities to access exercise were very, very limited when you were being treated for cancer or afterwards. To exercise with people who are in a similar situation, you can lose a lot of confidence and it can really affect you. I've exercised all my life and been really involved in physical activity, but I found it really, really hard, especially recently when I was treated for breast cancer. I also found that despite all the information that's out there, just generally about how we should spend more time exercising, and we should do a minimum of 150 minutes or 2.5 hours per week, that there was very little services for people. This is improving and there's more and more opportunities becoming available, but I felt, having been treated at Leeds myself, that the treatment I received was brilliant, but the opportunities to exercise were limited. So in my everyday job, I'm a lecturer in physical education, and so I spend a lot of time teaching people about physical activity. But I went away and did a specialist course in exercise and physical activity and cancer rehabilitation, so that I was able to work with people and offer the most up-to-date information, and as well as my own experience of being treated for cancer, to understand a lot about other different types of cancer and what people go through and what people need. What I'm going to do today is give you some examples of some of the things that we do or did in the face-to-face classes when we were able to meet, some of the things that you can do at home and why they're beneficial. There's lots of evidence to show now that exercising whilst being treated for cancer can help relieve some of the symptoms of the disease itself, and also of the treatments, especially things like fatigue, and also some information that shows if we do the minimum of 150 minutes a week, which sounds an awful lot, but I'll explain more about that and show you more ideas as we go on. We do that it can help to reduce the chances of recurrence of some cancers. So there's lots of just the general benefits, but especially if you're living with and beyond cancer, that you can take part in. As adults and some older adults who are living with and beyond cancer, we need to think about improving cardiovascular health, or that you might hear that sometimes called aerobic health, that's heart and lungs. Improving strength, so bone and muscle strength, and improving balance and flexibility is really important as well. Don't forget that many of these exercises can be what you do anyway as part of your everyday life. Gardening, shopping, cleaning, they all contribute. If you get a bit hot and sweaty, if your heart rate raises, you feel like a little bit tired afterwards, all these things contribute. You're probably doing a lot of them anyway. The most up-to-date information is for adults to take part in at least 150 minutes of moderate intensity physical activity per week, or 75 minutes of vigorous intensity. Moderate intensity consists of doing exercise where you can still hold a conversation, that you're not really heavily breathing and stop struggling to breathe. And this 150 minutes or 2.5 hours that we're talking about, which sounds an awful lot, doesn't have to be made up in large amounts of time. So you don't have to spend 20 minutes exercising, even 10. Any bouts of activity that you do can contribute to that time. So if you walk briskly to the bus stop and it takes you 10 minutes, and you do that 5 days a week there and back to go to work, that's a huge amount of your time. One of the things I always recommend is marching on the spot while the kettle's boiling. You know, your kettle might take 3 minutes to boil. You do it 5 times a day, 7 days a week. Again, that's a huge amount of time. That's 1 hour and 45 minutes out of the 2.5 hours recommended exercise a week. Can you believe it? And you might not have even moved from where the kettle's boiling. It can be really frustrating if you've been very active when you've been diagnosed with cancer or before you were treated for cancer. It can be really, really frustrating for people because they'll say to me, I used to run 10Ks and now I find it hard to walk up the stairs. Almost you have to think to yourself where you're at now. You might be almost starting from scratch again, and just gradually build up. Any amount of exercise, according to national guidelines, especially for those who are used to only low levels of activity, can have benefits. Here's another exercise that you can do to just keep moving. So you only need a very small amount of space, and arms are either by the sides, like this, stepping to the sides. It's entirely up to you how far you step. For some people, it might be a very short amount. Concentrate on transferring the weight from one foot to the other. It doesn't need to be fast. It can be just nice and controlled. Okay, you can do it faster if you're able to, which is great. Flexibility is really, really important part of keeping physically well, physically fit, physically active. And there's been more and more evidence in recent years showing that what we call dynamic stretching is really the best way to go about it. So doing stretches, for example, stretching like this while you're moving, rather than holding a stretch and holding it for a certain amount of time, up to about 20 seconds. And that's all very well, and that's great if we can do it. But for many of the patients that I work with and the clients that I work with, that can be really, really difficult because of all the restrictions they've got, whether it be from cancer treatment or it be other what we call comorbidities, issues that they're dealing with. So we still will do what we call static stretching, stretching on the spot. What we'll do first is we'll do activities where it gets your heart rate raised, it gets the blood pumping around the body, gets you warmer, and there's less chance of injury. So first of all, we'll do some of the activities that I've shown you. So either marching, either standing or sitting. So starting to get that heart rate raised, either doing side steps, which we can do here, like this, sitting, and we can do our stretches while we're moving. So reaching the arm over, keeping the tummy tucked in, don't arch your back, and then the other arm. Cheers. So stand, if you can, with your feet shoulder width apart, or if you need to sit, you can just get your chair. And again, sit, feet shoulder width apart, sitting up nice and straight. Keep your bottom away from the back of the chair so that you don't slump with your back. Sitting up nice and straight, shoulders back. Let's take one arm up if you can and reach it up towards the ceiling. And hold that for up to about 20 seconds. You know, you might only be able to get your arm to here, that's absolutely fine. Or here, just as much as you can, without arching your back. So either sitting or standing.
And obviously, if you can, doing one arm then the other, or one side then the other, or one leg then the other, if you're able to.
Turn your head to the side, keeping your shoulders back, but your shoulder blades not pinned together. And then to increase that stretch, drop your chin down towards your shoulder, and you should feel that in the opposite side. And doing the same again on the other side. Turn your head to the side and drop your chin down. Don't let your shoulders slump forwards because then you lose that stretch. and back to the front. You can also drop your ear towards your shoulder. Again, don't shrug your shoulders up, keep them down, relaxed, but back slightly. And to the other side. While moving, we can do some of these stretches. Reaching out to the front. Don't lean forwards. At the moment, you're stretching from your shoulders, arms going forwards. Might be that you only get to here, that's fine. Just do it to the best of your ability. Some people may just be able to do it with one arm. Reaching your arms to the sides. Reaching, opening your chest, stretching, taking your arms up. Again, just do what you can. Might just be with one arm that you can do it. Obviously, when we're exercising, it's important to exercise the whole body, whether that be flexibility, strength, any of those things. But let's have a little think now about leg stretches that are achievable for the people like yourselves that need that little bit of extra help. Or you might be starting from scratch. You might see people at the gym wanting to stretch their quadriceps muscles at the front of their thighs, and quite easily getting hold of their ankle and stretching. That can be really, really difficult for people. So in order to stretch the front of our thigh, which can get very tight, as can the back, especially if you're sitting a lot. So what we would advise is do a little bit of activity, whether it's walk around the block and then do some stretches. So get your heart rate up, get the blood flowing, and then do some stretches. So that exercise I showed you there, you can do it sat on a chair. So you would sit side on, and you would either get hold of your ankle, sitting up nice and straight and pushing back slightly through the hip. That can be really difficult still for people. What you can do is you can hook your finger in the back of your shoe or your trainer, and you get exactly the same effect. If you've got a pair of trousers on, you can get hold of your trousers and use your trousers to lift your leg as well. We've had clients at the Sir Robert Ogden Centre in the 70s and 80s doing these type of exercises and these type of stretches. You can even do it on the floor or on the bed. Bed's not great because it's not as a soft surface, but I'll show you now how you can do it when you're in a lying position. Obviously this means that you're much more stable when you're doing it. So keeping your body in a straight line and bending your leg back. Holding it for about 20 seconds. But if you can't hold it for that long at first, just do it for 10. You know, if you can't get your heel up towards your bottom, just bend it back and do it as much as you can. All of this, as you've seen, is adaptable. We can do it so that any of you can take part. We've just had a little look there at stretching the front of our thighs. What about the back of your thigh? This can get very tight. Your hamstring muscles here at the top of your leg at the back, and also your calf muscles as well, can get really, really tight. Again, you'll see people, you know, you might look at an exercise video and you see where they put one foot in front of the other, sit back, get your bottom bent, your back straight, put your hand on your bent leg, not your straight leg, pulling your toe up towards you, and this stretches the back of your leg. Well, that wasn't stretching anything because that doesn't get stretched. You do it sitting just as easily. And I find this really effective for the people that I've worked with. So you put one leg out, sitting up nice and straight. Again, the posture and the technique is really important. And what you do is you bend from your waist, and that'll increase the stretch in the back of your leg. Pull your toe up towards you, not physically, but lifting it slightly, just till you can feel that stretch. The further you go down, the more it stretches in the back of your thigh, also into your calf.